Professor Teo Yik Ying joins me now. He's the Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back, Professor. So today's round of curbs follows previous stricter measures that went into effect just 6 days ago. Are these greater restrictions necessary, do you think? Of course, our local cases are rising. Socializing is more limited, yet things like congregational services are still allowed and there's no social distancing on public transport.
So thank you for having me back. Yes, indeed, stricter curbs were imposed less than a week ago, but we have seen the situation worsen very quickly. And to put it in perspective, a month ago, we were looking at 0 community cases. And within a span of a month, we are now looking at a number of community clusters that continue to grow with the daily reports. This is not a good sign because this says that both the speed and the spread of infections in the community are happening faster than our contact tracing and isolation protocols before we can even intervene to cut the chains of transmission. So to really slow down the transmission and in order to let our protocols catch up and once again be ahead of the community spread, we really need to impose more restrictions in the community to cut down on the degree of interactions between people. This is an infectious disease and the coronavirus spreads when people come together and interact. By cutting the number of people allowed to come together, especially in indoor settings without masks, there is less opportunity for the coronavirus to spread. So this round of stricter curbs is very specific to minimize indoor interactions, especially where people will take off their mask, whether for a short time or for an extended time, such as dining or group gatherings. And we have always emphasized that dining together, eating together is one of the riskiest activities during the pandemic. And in terms of public transportation, yes, there is still no social distancing, especially during peak hours, but now with working from home as the default, hopefully public transport will be less crowded. And at the same time, we actually continue to wear our mask while on the bus and on the MRT. So if people continue to be conscious not to speak when in public transport, the risk continues to be very low. And I think it's important to also remember that Singapore has had almost 1.5 years of COVID-19 now. And actually till today, we really do not have any people that were infected because they were taking public transport. So the risk really is low if we wear our mask and we refrain from speaking while on the bus or on the train.